Now we're going to talk about the contours that we utilize in our abutments and our final restorations. So the first contour we want to talk about is the subcritical contour. And this corresponds to the deepest part of the implant restoration, closest to the implant itself. And this area is kind of critical, and why we use the colored abutment, right? Because it influences the peri-implant soft tissue support and gingival color, so we don't get that dark shadow show through. The important area to look at is the critical contour in blue. This is the most superficial area, and it will influence ultimately our gingival levels as well as the zenith location. And because the tissue is keratinized, we can really push it around and get it to work to our advantage. And part of the getting the proper height of the tooth is that we need to understand and replicate the CEJ, because this will determine and maintain the level of our facial mucosa. And I'm going to go into that in a little bit in a moment, okay? Now, returning to Barbara, here's her provisional, right? And we can take a look at it, and it doesn't look too bad. However, if you look at the mesopapilla, it's lacking full tissue fill. So this would be a 1. The trick is, can we get it to a 2? And that would be really nice. If we got this end result, this wouldn't be half bad. You can also take a look, at the distal papilla of that provisional, and you can see how the narrow triangular shaped tooth, exacerbates the look that's not quite right. So what are we going to do? Well, again, we stop and evaluate the white aesthetics. Is the outline of the tooth, is the gingival level acceptable? Is it symmetrical enough to be accepted as an excellent result? And I would say yes. You can have about a 0.5 millimeter difference in height of centrals, and that is perfectly acceptable to most viewers and most patients. So from that, if the tissue were too incisally and you wanted the tooth to look longer, you want to push it more apically, then you can over contour in the critical zone. The restoration, the abutment, and the tissue will be pushed upward more apically. And we'll discuss that with some visuals in a second. Now, in terms of the gingival embrasure and fill, if it's slightly deficient, as is in case in Barbara's case, what we can do is in the critical zone, we can widen the restoration or the abutment, increase the convexity, and push the tissue against the adjacent tooth, which will also push the tissue more incisally. So what am I talking about? So when we have the situation as you see on the left where the fill is not complete, well, if you change the critical contour, make it more convex, the net effect is you're going to push the tissue against the adjacent tooth, and it'll also be squeezed more incisally, and this will fill the embrasure. And from our systematic review, again, it's not necessarily going to be limited at the 5 millimeters that Tarnow talked about. It could be significantly more. So we can use this to our advantage. Now I want to show you a different case. This is Sophia, to demonstrate what I'm talking about, because in Barbara's case, I'm doing adjacent teeth. In Sophia's case, I'm only doing one tooth, one central. And if you look, again, I've got a standard healing abutment in place, right? And if you go ahead and, even though she's got a long contact, you can still see there's going to be a slight little gingival triangle. And while it's only a 1, the question is, can we make it a 2? Can we go from good to excellent? So we're going to go ahead and do that with using our critical contours. And understand, the critical contour can be worked out not only in the abutment, but it can be worked out in the restoration itself. So let me show you how this happens and what we did. So first, let's just look at the outline of the gingival zenith as it exists, right? Now, what I'm going to do is I'm going to make the restoration more convex. It's going to be broader and wider, and that's demonstrated by the red dotted lines. And what's going to support and define the gingival zenith and the length of my tooth is the CEJ, which is the white line. So as this restoration is seated, and let's move the red line to where it's going to ultimately end up, you can see that it is broader than the green dotted line. This is going to have the effect of, again, pushing the tissue against the adjacent teeth, and the tissue will then also be pushed incisally to help fill the gingival embrasure. So as this tooth is placed, and we're going to look at it post-delivery at 2 weeks, you can see now we have complete gingival fill. You know, again, the thing will balance out and smooth out a little bit more over time, but I think this is really nice pink aesthetics. You know, it'd be hard-pressed to tell that that's an implant restoration. You know, the white aesthetics is pretty good. Value's just a little off, but overall I'd give this a solid 9, I think, as an endpoint result. It's pretty believable from conversation distance. You know, another little trick, and it's a little off on a tangent, but look how nice the distal papilla looks. And even though it's next to a tapered tooth, a more tapered tooth, we kind of pulled off an illusion here by make the distal of that central to overlap the lateral a little bit, and this has the net effect of making the gingival embrasure looking small. So it's kind of a little, little hack that you can use.